So what are the features and what are the symptoms, clinical features of this cancer? So if you see any cancer cells, so depends upon the site and also depends upon the severity, the symptoms will be different. So in the early, the cancer symptoms may be asymptomatic, it won't, or maybe these are mild symptoms, or it may be asymptomatic. However, some symptoms may be the result of the cancer or less serious illness. So some cancers are going to be give the less symptoms. When it's going to be the severity is the more severity, then only they can feel the symptoms of the cancer. Sometimes it's asymptomatic. Symptoms will depend upon the involvement of the organ, tissue, and also structure. So what structure and what tissue is going to be involved? So depends upon the tissue. So depends upon the structure organ. So the symptoms will be different. So if you see the common symptoms of the cancer is going to be in the men and also women. So is going to be the common symptoms are the pain and weight loss without trying and also fatigue. And so many other symptoms are fever, changes in the skin, and sore throat, and also cough, unusual bleeding, and anemia. So these are the common causes in the men and women together. So this is the pain is the foremost important symptoms in the tumor. So especially in the bone cancers. So who are having the bone cancers, most of the people are going to hurt from the beginning. So some brain tumors causes the headache. So just now we discussed because of the space occupying lesions and also because of this metastatic event, the pressure, intracranial pressure is going to be increased. So because of the increased intracranial pressure, so those people are going to get the severe headache and blurred vision, confusion, and vomiting and dizziness. So these symptoms are going to get in case of the brain tumors. And also these tumor headaches last for days and don't get better with the treatment. And also it's the pain is going to be increased. They won't get any relief with any treatments. So pain can also be the late sign of the cancer. So some of the conditions, some of the different type of the cancers are going to be, pain is going also is a late sign of the cancer. So another symptom in the cancer is the weight loss without trying. So almost half of the people who have the cancer, so lose the weight. It's often one of the signs that they notice first. So according to their hepatite and also according to the health status, and also this is the weight loss is the commonest symptom in the cancer patients. And also fatigue. Fatigue means tired. So most of the people, so if you are tired all the times and rest doesn't help. So sometimes if they take rest prolonged time or any time also, it won't give any relief. So most commonly who are having the leukemia, so most people are going to be faced with the fatigue. And also in case of the colon cancer or stomach cancer also, so those people are going to be more chance to get the fatigue. So tiredness will be more in case of the cancer related, especially in the stomach cancer and also leukemia. So this cancer related weight loss can leave you exhausted too. So because of the weight loss also, so they are going to get is a fatigue and also tiredness very easily. And another symptom is the fever. Fever is the high and last more than 3 days. Some blood cancers like lymphoma cause the fever for days or even weeks. So some is most commonly you are having a more than 3 days. So we can suspect any infection or maybe any inflammations or maybe it's because of any cancer. So sometimes this fever is going to be more than like a weeks together. So here and also another symptom is going to be changes in the skin color. So especially in case of any like a skin cancer, in case of any moles or bumps. So these are some kinds of the skin cancers. So if it is darkened or looks yellow or red or itches or if it sprouts more like it's a more hair. So if you are unexplained rashes, so it could be a sign of the liver or ovarian or kidney cancers or lymphoma. So if anybody having any skin complications such as like a yellow colors and also red and itches and also any sprouts are more hairy. So these things are, so if it unexplained rashes, so it is a symptom of the liver or maybe ovarian or kidney cancers or lymphoma. So coming to the next one is the sore throat. So sore that don't heal, so that means is going to be the spots that bleed or won't go away, also a sign of the skin cancer. So sores on the skin, so it's going to be like a, always they will get some sores on the skin, or maybe oral cancer can start with the sores in the mouth, or if you smoke, the chew tobacco or drink a lot of alcohol, so you are the higher risk. So who are taking the high smoking and also high alcohol and also chewing tobacco, so these are the more common causative factor for the skin cancer and also throat cancer. So those people are going to get the source, so it won't get healing process. And also cough also. Cough is the most common symptom of the cough, and also voice changes is related symptom of the lung cancer, or the voice and hoarseness of the, so it indicates the voice box or such as the larynx or thyroid gland involvement. And also unusual bleeding. So maybe blood in the is a poop is a symptom of the colon. So if the toileting or during the defecations, if the blood, so it may chance to get the any rectal cancer. So it's not every time is going to the any blood in the poop, it's not a cancer. Sometimes you are having hemorrhoids or any like a piles in the rectum, so and also anus, so may also get chance to get the bleeding in the feces during the defecations. And tumors along the urinary tract also cause of the blood in the urine. So sometimes during the voiding the urine also may chance to get the blood. So it indicates the any urine like a urinary bladder tumors or maybe kidney tumors. So another symptom is the anemia. So this is when the body doesn't have enough red blood cells, so which are made in the bone marrow. So in case of, especially in case of anybody having leukemia or lymphoma or multiple myeloma, so can damage the bone marrow. So if you are having damage in the bone marrow, so those people who won't get sufficient amount of the red cell productions. So that is the reason they are going to get the anemia. Tumors that spread from other places might crowd out regular red blood cells. So because of the other cells also, so if they spread from the other places also might crowd out. So this leads to the red blood cells are going to decrease. So it leads to the anemia. So these are the common features, common clinical features in the men and women, the same features. But if you see in the common symptoms in the men, so who are having some problem in the, or maybe these people and men are going to be more common with the prostate and lung and colorectal. So these cancers are more commonly seen in the men. So because of the prostate cancer and lung cancer and colorectal cancer, especially because of the prostate cancers, when the patient is want to pee or maybe is urinations, so may chance to get the severe pain and also may chance to get the blood in the urine. So these are the common features of the enlargement of the prostate gland or benign hyperplasia of the prostate. So these are the common complications in the men. So prostate cancer also may give the bleeding in the urine. And also any other a lump or pain or ache in the scrotum, so are also any scrotal pain or any lump in the scrotum or any swelling in the scrotum, so it may chance to give the testicular cancers. So we have to, while assessing physical examination, while examining the patients, so we have to check, we have to investigate, or we have to palpate, so all the structures, so to identify any lump or maybe any tenderness, any pain, so we have to check it during the physical examinations. So if you see in the women, so most common cancers are okay. The most common cancers are tumors are commonly seen in the women, so especially in the breast and lung and colorectal cancers. So who are having these complications, so they may chance to get the other complications associated with these cancers, may chance to get the cancer in the uterus, endometrium, and also cervix, vagina, and also uvula. So these are also may chance to get related to reproductive system involvement. So those women may chance to get the vaginal bleeding or discharge. So who are having this vaginal bleeding and discharge, so these have to check out if happens between the periods or after the menopause. So any bleeding after the period, so after finishing the 5 days of the menstrual cycle, so the bleeding period, so then any other bleeding again, or maybe after the menopause, any bleeding occurs. So these are going to be the most commonly seen the endometrial cancers. So may gives the vaginal bleeding and also discharge. And also next one is they may chance to get the changes in the appetite. So ovarian cancers can make you feel full or make it too hard to eat. So who are having always they may chance to get the bloating of the stomach, or maybe in case of they may difficult to eat also. They're not feeling to eat. So other cancers cause the indigestion or nausea. Also, cancers is not the only illness that changes your appetite, but check with your doctors if you have trouble eating for 2 weeks or longer time. So in case of not only this cancer or who are having the gastric symptoms or gastritis or any other infections also, so unable to take the food properly. So in these conditions, so how to doctor consult the doctor. So before that, if you feel any other serious complications. So, and also belly pain or bloating. So, who are having some gastric problems or also is a cramps. So, they may chance to get the bloating and also the may chance to get the gassy and also creamy in the stomach. So in these conditions, we have to those people have to talk with the doctors and how to explain about their symptoms, so they can easily differentially diagnose what is the causative factors with stomach pain or maybe bloating with other weight loss. So they can easily differentially diagnose and also identify the causative factors. In case of any breast changes, in case of the breast tumors, so we have to check the if the patient having any the breast size and shape is different, or is there any lump is found, or in case of any sudden changes in the size, or because of the inflammation, or because of the this mastitis, that's inflammation of the uh, breast, or in case of the any discharge from the nipple, is there any white discharge or maybe blood discharge? So I have to find, or is there any spots or any other skin changes around the nipple. So these things have to found in between while examining physical examining the patients. So we have to know what are the major chief complaint factors. So that according to we have to differentially diagnosis. So that is about the common symptoms in the men and women, and also some symptoms commonly seen in the men, especially for the prostate-related problems, and also in women also is the breast-related problems. But only 1% we can also commonly see observe in the men also having the breast cancer. So we can check in the breast-related complications, women as well as the men. We have to check equally. So that's all about the today's the tumors symptoms and also clinical features. So how we are going to give the gradings, how much of the severity of the tumors. So these are going to be depends upon the two factors. So these are going to be the degree of the anaplasia and also rate of the growth. So these are going to be according to the standardized the classifications. So these are classified into the 4 grades. So these are the first grade is going to be the well differentiated. So is going to be the abnormal cells, that is anaplastic cells are going to be less than 25%. Well differentiated means their appearance and also they're going to be the looks like is a normal like a shape and size is going to be looks like it's a normal. But if you see the grade 2 one is moderately differentiated. So that means moderately differentiated means the cell size and shapes are going to be altered. So abnormal shape is slightly altered to the normal shape. So these cells are abnormal cells are going to be is a more than 25% to the 50%. So coming to the grade 3, so in the grade 3 is going to be moderately differentiated. So that means the appearance of the cells are going to be it's not poorly differentiated. Poorly differentiated means the organelles and also the nucleus as well as the organelles are going to be alter the size and shapes, and also abnormal cells are going to be increased in the more than 50 to 75% of the abnormal cells. The grade 1 is going to be the poorly differentiated, or is the anaplastic cells more than 75% of the cells. So that means almost is going to be the severe stage of the cancer. So these cancers we can explain according to the abnormal cell patterns and also the differentiations, how the differentiations. If it is well differentiations, so the growth of the cells are going to be slow and also is a slow aggressive. If the poor well differentiated, so poor differentiated is going to be the severe complications as well as it increasing the symptoms and also fast growth of the cancers. So according to these grades, so we can know the how much the speed of the growth of the cancer cells. So easily we can calculate. So how many days they are going to be survive properly. That means safely, or when they may chance to get the death. So we can easily predict according to the cancer grades. And also, if you see the another type of the classification of the cancers, so this is going to be the, so how the cancer is going to be situated. Is it the localized or regionally, or is going to be distant, or how is going to be spread? So, and also according to the involvement of the tissue also, we are going to tell, is it going to be the benign tumors, or is it maybe metastasis, or how the metastasis is going to be different to the regions. So we can we can give the like a the stages and maybe classification of the tumors. So if any tumor is at in situ, so in the in situ means, so the cell abnormal cell growth be there present, but have not spread to the near tissue. So is where they are going to get the, where the cells are going to be developed, the abnormal cells. So the cancer is going to stay in that particular stage. It won't get to, it won't explain, it won't like extend to the other parts of the cells. So in that type of the cancer is called as, is a cancerous in a situ. So the carcinoma in situ means, so is the where the cell abnormal cells going to develop, the cells are going to be increasing the size. So and also it's going to increasing the shape and also size, but it's not going to spread to the other parts of the body. So so that cancers are called cancers in the situ. And also next one is the localized. So the cancer is limited to the place where it started, but with no signs that has the spreaded. So that means, is this going to start in a particular place, but here no signs that has spread. So it's not going to be spread to the any very less sign, no signs are going to be happening. In the regional means, in the regional cancers are going to be, the cancer has spread to the nearby, the lymph nodes, tissues and organs. The surrounding structures are going to be affected. So because of the maybe either benign tumors or maybe malignant tumor, but the surrounding tissue is going to be affected because of the compression, or but because of the most commonly is going to be the malignant tumors are affected to the lymph nodes and also other organs. So in the distant cancers, so in the distant cancers are going to be malignant cancers. So this is going to spread to the one place to another part of the cancer. So especially if anybody get the cancer in the lungs, so it may spread to the brain easily through the blood and also lymphatic system. And also some types of the cancers are, so there is not enough information to figure out the stage. So there is no exact, that means we cannot say, is it from the one place to another place, or is it shifted from the through the bloodstream, or is the like a lymphatic system. So we cannot say exactly. So this is not enough information to figure out the stage. So which stage sometimes is not going to be like a, which is grades 1 or 2 or 3, or we cannot say any grades, or maybe we cannot say is it there in the same location or in a particular location, any regions, we cannot say. So in those conditions, we can say is the unknown staging of the cancer. So that is the different type of the cancers and also stages. But how we are going to give the standardized staging of the cancers? So according to the international standards, so the staging according to the, we are going to classify the staging according to the TNM classifications. TNM classifications. So according to these classifications, so we can analyze so how the cancer is spread to the other parts of the body, how much of the extent the spread is there to the other parts of the body. So depends upon the involvement of the nodes and metastasis, and also is going to be affects the metastasis. So if the tumors are affecting to the, so if you see the classification TNM, T for the tumors, N for nodes, M for metastasis. So it's going to be the, it's a nodes indicates whether or not the tumor has spread into the neighboring lymph nodes. So these means the lymph nodes are going to be indicate means how it's spread to the lymphatic tissues. So according to the involvement of the tumors and nodes and metastasis, we can say the, so how much of the severity, so we can predict, and according to the stages, we can give the severity also. So this system is commonly used for solid tumors. So less applicable to the lymphomas and also leukemias. So this one is going to depends upon the size and also depends upon the shape. So it's especially for the solid tumors. In case of lymphomas, in case of leukemias, lymphomas means involvement of the lymphatic system. If any cancer cells in the lymphatic system, and also leukemias are especially for the blood cells, white blood cells. So in those conditions, we are not going to categorize, we are not going to the staging of the tumors with the TNM classifications. So this T for the tumor. So we are going to see the size of the primary tumor. So and also nodes how it's affected. Is affected to the regional or local effects, involvement, or metastasis. If there is metastasis there, is there in distant or in the transmission of the or extent of the tumor or maybe cancer from the one place to another place. So according to these things, so we can understand the severity of the tumors. So if you see these classifications, so the T about the tumor. So in the tumor, we can see the Tx, T0, TIS, T1, T2, T3, and T4. So these things, so if you see the Tx means no available information on the primary tumor. So that means, so there is no information. If we suspect any about the tumor, the primary tumor, no information. So that means is the less amount of the tumor symptoms and also maybe asymptomatic. So no involvement of the tumor development. So this may be with a, we can say with it indicates the Tx. And also no evidence of the primary tumor, that is T0. And also TIS means only carcinoma in situ on the primary sites. So if anybody having the only cancer in the primary sites, so this is called the carcinoma in situ. So we can give the indication, its signaling is uh, TIS. So that means a tumor in the in situ. And also if it is one, the staging will be tumor in one situ. So if the T1 means if the tumor is less than 2 centimeters. So if the T2 means the 2 more than 2 to 4 centimeters. T3 means more than 4 centimeters. T4 means the more than 4 centimeters. Involvement of the nectrum and also the pterygoid muscles and base of the tongue and also skin. If the involvement is more than 4 centimeters, along associated with the involvement of this muscles and also tongue and also skin, so if the staging is will be the T4 stage. So this is about the tumors. So coming to the is next about the nodes. Nodes means is it going to be the regional or local involvement of the nodes, lymph nodes involvement. If it is a TX, so that means cannot be assessed. That means it's not involvement to the lymph nodes. And so N0, it means no clinical positive nodes. So that means no involvement of the lymph nodes. N1 means the single or ipsilateral is a more than 3 centimeters. So that means going to be effect of the lymph nodes is the single lymph nodes and also ipsilateral side, only one side is going to be affected, which is also is a more than 3 centimeters. The N2A is going to be single, ipsilateral, that size is going to be 3 to 6 centimeters. And also N2B is a multiple, ipsilateral is a less than 6 centimeters. And also N3 is a massive, ipsilateral or bilateral or contralateral. Maybe it's a one side or two sides or opposite side, but it's going to be the massive, that means a bigger size. And next one is the N3A, that is the ipsilateral nodes. One more than one is going to be one more than the 6 centimeters. So that the size of the or involvement of the lymphatic system, lymph nodes are going to be more than the 6 centimeters. And also next one is the N3B is going to be, it is going to be effect to the bilateral. So bilateral means is towards the right side as well as the left side. And also NC3 is going to be the contralateral. So it's a contralateral means the opposite side. So that means if, for example, is affected to one side, is affected to the opposite side. Okay, that is about the TNM staging and the nodes, that is involvement of the nodes. So coming to the metastasis, so if it's a MX stage means, so it's not assessed to the like involvement of the metastasis. So there is no like a signs of the metastasis. Also M0 means no evidence, no evidence. So no distance, and that means no evidence spread from the one place to another place. If it is the M1 stage means it indicating they're having the distant metastasis present. So that means they're having the one place to another place, the extension, or maybe is expanding to the one place to another place. So according to the stagings, so we can give the staging of the tumors. So involvement of the tumor size and also tumor involvement of the nodes and also metastasis. So we can give the stages. So this is about the the stages of the cancer. So how much of effect is there? So according to stages, we can give the what the complications they may chance to get, how much of the survival rate is there according to this staging, we can give easily. So how we are going to diagnose these cancers? So up till now, until now, there's so much of research evidences and also so much of technology. So there is no single test to diagnose the cancer test. So how to do so many different type of tests and also to evaluate the patients completely and thoroughly through the physical examination and also investigation procedures and also diagnostic tests and as also clinical according to the clinical features. So we have to thorough and also have thorough to assess and also thoroughly, as well as we have to see the diagnostic procedures, physical examinations. Then only we can give the final conclusions according to the all these diagnostic procedures, the process. So here many tests are needed to determine whether the person has the cancer or is the another conditions, so such as mimicking like a cancer, which are the like infections or maybe other related symptoms. So that's the reasons we have to check the blood like a analysis in the blood and also urine and also bio like a blood like a tumor markers, imaging technology, how to use all the techniques to and also to evaluate and also to give the final diagnosis. And also effective diagnosis testing is used to confirm or eliminate the presence of the disease. We are going to eliminate the disease as well as we are going to monitor the disease process and plan for the evaluate the effectiveness of the treatment. So that is the important. This diagnostics is going to be not only diagnose the conditions and also it also going to is eliminate the disease if we diagnose early, and also we are going to monitor the disease process, how the disease is going to develop, and also you will evaluate the effectiveness of the treatment, how is responding to the treatment and also therapy. So we can use the diagnostic procedures. In some cases, it is necessary to repeat the testing when the person's condition is changed. If a simple collected was not good quality, and abnormal test results need to be confirmed. So here is going to be, that's the reasons we have to like repeat the test, how the improvement sometimes is not going to give the clear informations, or sometimes is going to be alter the response, maybe the fluctuate. So we have to do these tests and also record it. So then only we can check the how is the progression is there, how is the improvement is there with the medications and also disease progress and also the prognosis. So many different tests we have to do to rule out the causative factors as well as the what type of the cancers. For this diagnosis, so many tests are there. So these procedures including the imaging technology, so such as the X-ray, CT scan, and also MRI scan, and also laboratory tests, including the test of the tumor markers, and also the tumor biopsy, so endoscopic examinations, some surgeries, and genetic testing. So these are all going to give the clues about the tumor and also give the information about the what type of the tumors. So these diagnoses are including so many types. So these are the lab tests, diagnostic imagings, endoscopic examinations, genetic tests, and also tumor biopsies. So these are the different types of the investigation procedures and diagnostic procedures for the assessment of the tumors. So if you see the lab tests, so these lab tests are in the many lab tests. So these are going to give uses the chemical process to measure the level of the chemical components in the body fluids and also tissues, especially in the these common specimens used in the clinical chemistry is the blood and also urine. So what are the toxins? So what are the abnormalities we are going to, if any develop in the abnormalities in our body, in the fluids. So we commonly check, we can find in the urine and also blood, we are going to find the different like toxins and also related to the cancerous materials we are going to find. So if you do the urine analysis and blood analysis, is easily found the abnormal cell development and also growth. So and also components may including the blood glucose, electrolytes, enzymes, hormones, lipids, other metabolic substance and proteins. So these are also we have to check in case of the lab test. So these are going to use the clues to identify the what type of the cancer and also which type of the structure is involved. So according to this, according to these reports, so we are going to identify. So these lab reports are especially the blood test and also complete blood picture, blood count, and also urine analysis and tumor markers. So if you want to know the exact cancers, so we have to do the so many tumor factors, tumor markers to evaluate the what type of the tumors. And also especially for the blood test. So what blood tests are going to give the complete information about the cancers. So these blood tests are going to give the clear information about the cell count, measurement of the various blood chemistries, and also markers, and also of the inflammations. So these are going to identify in the blood test. Especially, so when we measure the many things in the blood, such as the salts, blood cell count, proteins markers specific to the hearts. So we are going to check all these things in the blood test. So additional tests may including the blood chemistries and also evaluation of the liver, kidney functions, and also genetic studies. If this you are having the kidney abnormalities or liver abnormalities or genetic abnormalities, also we are going to find in the this blood test. And also in case of some genetic disorders or in the genetic testing also, maybe we can recommend some blood test. So that is the importance of the blood test. So during the investigation procedures. And also coming to the next to the blood test, so it's complete blood count. So this is the very, very important if you want to know the type of the is it the cancer or infection or inflammations. So what are the causative factors for the illness? So we can analyze easily with the blood count. So these are going to be the complete blood count. So measure the size, number, and maturity of the different blood cells in a specific blood values. So this is the most common type of the test who have got the illness. So with according to these reports, the size and shape and also volume of the blood cells. So we are going to differentially diagnose the causative factors and also type of disease. For example, the red blood cells are important for the carrying the oxygen and also fighting anemia and also fatigue. So if, for example, these red blood cells are going to be important to know our health status. The hemoglobin portion of the RBC or the CBC measure the oxygen capacity and also of the red blood cells, while hematocrit measures percentage of the red blood cells in the blood. So that is the reasons if you want to know the level of the health status and also oxygen level in our blood also, if you know the hematocrit measurements, so we can know the blood cell health status. And also what about the white blood cells? So this also we have to know the white blood cell count. So we can know the white blood cells count. So depends upon the severity of the infections. So this may alter if anybody get any infections or in case of anybody having any like tumors also may chance to get the increasing the white blood cells. Or maybe it's maybe decreased in case of any rheumatic diseases or any other reaction to the medications. So we have to know in which condition the red blood cells are increased and which condition the white blood cells are going to be increased. So in case of red blood cell decrease means, so those people having the anemia or maybe who are having the anemia, so they may chance to get the decreasing the blood circulations and also oxygen supplies to the tissues. So we can easily understand. Or same like in the who are having the high like a WBC count, white blood cell count. So it indicates in the infections or maybe in case of who are having some immunity disorders also. So may chance to get the high infection that means is the blood high blood white blood cell count. But in case of decreasing these cells, maybe is because of the rheumatic disorder or in case of the any medical like any medication reactions. And also next one is a platelet also have to check. So these platelets prevent the body from the bleeding and also brewing easily. So this is also usually performed to check for the blood infections. So who are having any blood infections. So if we check the platelet count also, so we can get some clues about the blood infections or maybe blood cancers. So coming to the urine analysis. So these urine analysis are going to be give the full information about the any cells, red blood cells or white blood cells, or maybe in case of any protein in the urine. So these are going to give some information about the urine analysis. So if you get all the information about the red blood cells, white blood cells, and also infections and also excessive protein. So these will give the clear information about who are having some problem with any kidney disease, any cardiovascular disease, or maybe who are having some diabetes. So in case of who are having the high level of the proteins, so it indicating the proteinuria, it indicates the kidney disease and also cardiovascular disease. Or maybe who are having any like a bleeding inside the urine, so it may indicating any infection or in case of any tumor or any in case of the prostatic tumors or benign hyperplasia of the prostate. So these are may use some clues regarding what type of conditions may chance to get with this urine analysis we can easily understand. So that is about the urine analysis. So another one important thing is the tumor markers. So these tumor markers are very, very important while assessing the patients and about regarding the cancer. So these are going to be the prostate specific antigens. So the special test to exactly know about that like a cancer cells. So these are going to be the tumor specific, that is a prostate specific antigen is going to be always present in the low concentration in the blood of adult male. So, but this is going to the normal. But if it is elevated, this prostate, like the specific antigen, if it is elevated, it indicating the prostate cancers. So who are having the highest high level of the prostate specific antigen means, so it is indicating the like a prostate cancer, or maybe is conditions of benign prostatic hyperplasia. So it's most commonly seen in the who are having the cancers. So these levels are used to evaluate the how a patient has responded to treatment and check for the tumor recurrence. So not only for the assessment and also during the treatment of the prostate cancer, also we have to check the prostate specific antigen, because we have to know the how the progression with the treatment with the medications and also other treatment plans. So how the improvement in the this level of the prostate specific antigen. So coming to the prostatic acid phosphate. So this is also going to be is normally present in the small amount in the blood, but in case of prostate cancer, it also going to be increased. So prostate cancer, testicular cancer, leukemia, and also Hodgkin's, non-Hodgkin's lymphoma, as well as the non-cancerous conditions. So small amount is available in the blood, but who are in high levels of the this prostatic acid phosphate, it indicates the prostate cancer. So easily, if any patient complaining about the bleeding and also severe pain in the like a prostate regions, abdominal pain, and also in the penis levels, or maybe in case of the like a ureter level, so we can check about these two marker tests, so we can diagnose who are having the prostate cancer or any testicular cancers, so we can easily understand according to these test markers. And also next one is a CA 125 like a test markers. So this is going to be the ovarian cancer is most common cause of the elevated CA 125. So, and this is the most common in case of the in female who are having the ovarian cancers. So we can found this this is going to be elevated. And but cancers of the uterus, cervix, pancreas, liver, colon, breast, lung also, and also digestive tract also can rise in the this cancer levels of the CA125. So that is the reasons. So if we give this special test, so we can analyze what the different type of structure involved, we can easily understand. The several non-cancerous conditions can also elevate these CA125 is mainly used to monitor the treatment of the ovarian cancers. So sometimes we have to differentially diagnosis. So it may chance to get the non-cancerous cells also may increasing the cells. So we have to see the physical examinations, clinical symptomology, diagnostic procedures, along with these tumor markers. So all we have to differentially diagnose this, so we can confirm the tumors like a diagnosis. And also next, another one is the carcinoembryonic antigens. So this one is going to be found in the small amount in the blood. But in case of colorectal cancer, so this is going to be increased, and also this embryonic antigen is going to be increased in case of the colorectal cancers. So several other cancers also raise the carcinoembryonic antigen is going to be increased. So these are the special tests to identify this cancer like a markers. And also alpha fetoprotein also going to be normally present in the pregnant, so who is like in the fetus, but is going to be increased in case of who are having the liver cancer and also ovarian cancer and also testicular cancers. Next one is the human is a chorionic gonadotropin hormones, is a HCG hormone. So these also normally appears in the pregnancy, is produced by the placenta. So because of this thing only, we are going to identify the pregnancy is positive or negative through the test we are going to identify with this special test. But in case other than this pregnancy, if this antigen is increased, so this marker is increased. So in those conditions, if anybody having increase in the HCG levels, so it indicates the testis, ovaries, and livers and stomach cancer, and also lung also. So in case of one more thing is the marijuana, or nothing but is the opium or ganja also one of the causative factors, or may raise this HCG levels. So if you know all the information, we can easily differentially diagnosis. So we can diagnose and also cancers. So what type of cancers according to this tumor markers. And also this other marker CA, the 19.9. So these also going to be or having the colon and stomach cancers. So these levels are going to be increased. And also in case of the pancreatitis and gallstones also, these levels are going to be increased. And CA 15.3 also. So these also going to be used to course of the treatment with advanced breast cancers. So these also going to be increased, or who are having the colon, stomach, kidney also going to be increased. And also CA 27-29. So these markers are used to follow the advanced breast cancers. So in the treatment of breast cancer, so we are going to check the CA 27-29 cancer. The tumor markers are also helpful to identify the colon, stomach, and kidney and lung and ovary, pancreas, uterus, and liver cancers. As a bladder tumor marker studies, so these are going to be the characteristics of the markers are substance released by the bladder cancer cells in the urine. So these markers, so if any like a blood or any abnormal cells in the urine also, we are going to be identified with the bladder tumor marker studies. So we can easily understand what is the type of the cancer, we can easily understand. So these tumor markers are very important to diagnose what type of the tumors. And also another tumor marker is the lactate dehydrogenase. So this lactate dehydrogenase is a protein, is normally appears throughout the body in a small amount. But in many cancers, so is going to be this lactate dehydrogenase is going to be increased. So, but it is not useful in identifying the specific kind of the cancers, but measuring the LDH can be helpful monitoring the treatment for the cancers. So that means while giving the treatment, so how they are going to be respond, so how the levels are of the lactate dehydrogenase, so it will helpful in during the treatment of the cancers. So non-cancerous conditions that can raise the LDH, so also including the heart failure, hypothyroidism, anemia, lungs or liver disease also sometimes, so this lactate dehydrogenase is going to be increased. And also non-specific and also the neuron specific is analysis. So these are going to be associated with the several cancers, but is used most often to monitor the treatment patients with the neuroblastoma or the small cell lung cancers. So these are going to be, so these are tumor markers are going to be useful to identify the different type of the cancers, where the tumors are got the cancers, especially which organ is going to be affected. So with the tumor markers, we are going to identify what type of the tumors. So that's all about these are the tumor markers. So until now, we discuss about what are the different types of the characteristic features of the tumors, and also symptoms, what are the major symptoms in the men and women, and also what are the common symptoms in the men and what are the other common symptoms in the women. And also next one is what are the stages in the tumors, different type of the stages, how we are going to differentiate which one is like a severe stage and also less stage. And also is a blood test and also urine analysis and tumor markers. So until now, we discussed about the diagnosis of the tumors and cancer cells with tumor markers and also blood test and also urine analysis. So in the next topic, we are going to discuss about how is going to be the diagnostic with the imaging technology and also special techniques. So how we are going to discuss in the next class. Hope you understand clearly until now. If you have any doubts, you can message me. I can clearly explain and also. So see you in the next class. Thank you very much.